Depression, the heavy shadow over life. Depression, recognized as one of the most prevalent yet complex mental disorders worldwide, is not merely a fleeting feeling of sadness or boredom, but rather a mood disorder that can profoundly disrupt the very fabric of an individual's daily life. This condition, with its deep-seated influence, can significantly impair a person's functioning across various aspects of existence, from intimate relationships and social interactions, to work productivity and academic progress. Imagine a constant, heavy shadow cast over every facet of your life. This is a close representation of the experience of someone grappling with depression. This disorder manifests itself in a wide spectrum of symptoms, the most prominent of which is a deep and agonizing feeling of sadness. This sadness is not a simple sorrow, but an inner sense of emptiness and void that seems to erase all the vibrant colors of life. Alongside this feeling, the lack of motivation and interest in activities that were once enjoyable gradually distances the individual from the zest and enthusiasm for life. A reduced level of energy and a feeling of chronic fatigue, even after sufficient rest, are other prominent signs of depression. This lack of vitality makes even the simplest daily tasks feel like an arduous challenge. Sleep disturbances, whether prolonged and distressing insomnia or excessive hypersomnia that prevents the individual from being active, are also among the common symptoms of this disorder. Noticeable changes in appetite patterns, whether a sharp decrease and disinterest in food or a sudden increase and an insatiable craving for eating, can also be indicators of depression. Concentration and attention are also cognitive functions affected by depression. The individual may experience difficulty in remembering information, making decisions, and maintaining focus on various tasks. Feelings of worthlessness and guilt often manifest as negative thoughts and constant self-blame, severely undermining the individual's self-esteem. In more severe and profound cases, depression can lead to the formation of suicidal thoughts, which require immediate attention and professional intervention. It's important to note that the intensity and type of these symptoms can vary considerably from person to person, depending on the type of depression, personality traits, and environmental conditions. This varied diversity in clinical presentations is why depression manifests in various forms, which we will examine comprehensively and systematically in the following section. Types of depression and their distinctive characteristics. In this section, to better understand the multifaceted nature of depression, we will explore a detailed collection of recognized types of this disorder based on the unique characteristics and symptoms of each. Major Depressive Disorder, MDD. Key feature. This type of depression is characterized by severe, debilitating, and persistent periods of depressive symptoms. These episodes can last for weeks or months and significantly impair an individual's ability to perform daily activities. Key symptoms. Profound and pervasive sadness that does not easily lift. Loss of pleasure and interest in almost all activities. Anhedonia. Feelings of fatigue and severe lack of energy. Hypersomnia. Marked changes in appetite and weight. Psychomotor retardation or agitation. Feelings of worthlessness or excessive and inappropriate guilt. Reduced ability to concentrate and make decisions. And, ultimately, recurrent thoughts of death or suicide. Persistent depressive disorder. Dysthymia. Key feature. Dysthymia is a type of depression that manifests as a chronic and long-lasting, at least 2 years in adults and 1 year in children and adolescents, low-grade depression. Although the symptoms are not as debilitating as in MDD, their persistence can have a significant negative impact on an individual's quality of life. Key symptoms. Persistent low mood and feelings of sadness on most days. Loss of interest or pleasure in activities. Feelings of fatigue and low energy. Changes in appetite. Poor appetite or overeating. Sleep disturbances. Insomnia or hypersomnia. Low self-esteem. Difficulty concentrating and making decisions. And feelings of hopelessness. Bipolar disorder. Key feature. Bipolar disorder is characterized by extreme shifts in mood, including periods of depression, with symptoms similar to MDD, and periods of mania or hypomania. During the manic phase, the individual experiences an abnormally elevated mood, increased energy, racing thoughts, a decreased need for sleep, and risky behaviors. Key symptoms. Depressive episodes with symptoms mentioned in MDD, and manic or hypomanic episodes with symptoms such as increased energy and activity, excessively elevated or irritable mood, decreased need for sleep, rapid and pressured speech, racing thoughts, inflated self-esteem and grandiosity, engagement in risky and pleasurable behaviors, such as excessive spending, unsafe sexual practices, risky investments. Seasonal affective disorder, SAD. Key feature. This type of depression has a seasonal pattern, meaning that symptoms typically appear during a specific time of year, most commonly in the fall and winter with reduced sunlight, and improve with the change of seasons. Key symptoms. Depressed mood that intensifies during the fall and winter, increased sleepiness and feelings of excessive fatigue, increased appetite and cravings for carbohydrates leading to weight gain, decreased energy and motivation to engage in activities, and difficulty concentrating. Postpartum depression. Key feature. Postpartum depression is a type of depression that occurs in women after childbirth. This condition goes beyond the baby blues, which are usually mild and short-lived and can have serious implications for the health of both the mother and the child. Key symptoms: persistent feelings of sadness and despair, excessive anxiety and worry, irritability, feelings of guilt and worthlessness, difficulty bonding with the baby, or, conversely, excessive preoccupation with the baby's well-being, changes in appetite and sleep, extreme fatigue, and, in rare cases, thoughts of harming oneself or the baby. Situational depression, adjustment disorder with depressed mood. Key feature: this type of depression occurs as a natural and expected response to a stressful or shocking life event, such as the loss of a loved one, job loss, the end of a significant relationship. Key symptoms: feelings of sadness and grief, crying spells, anxiety, difficulty sleeping, loss of interest in activities, feelings of hopelessness, difficulty concentrating, and feelings of irritability. Symptoms usually subside within a few months after the stressful event. Atypical depression. Key feature: atypical depression is characterized by some features that differ from classic major depression, including the ability to experience a temporary positive mood in response to good events. Mood reactivity. Key symptoms: increased appetite and weight gain, sleeping too much, hypersomnia, a feeling of heaviness in the arms and legs, hypersensitivity to social rejection, and a mood pattern where the mood worsens in the evening. Treatment-resistant depression, TRD. Key feature: this term is used to describe depression that does not respond adequately to standard antidepressant medications and/or psychotherapy. Key symptoms: persistent depressive symptoms despite trying multiple types of medications and therapy sessions, feelings of hopelessness about getting better, and extreme fatigue resulting from the long-term struggle with depression. Psychotic depression. Key feature: this type of major depression is accompanied by symptoms of psychosis, such as delusions or hallucinations. Key symptoms: symptoms of major depression along with false and irrational beliefs. Delusions, such as intense feelings of guilt, believing one has a serious illness or is impoverished, and experiencing seeing or hearing things that are not there. Hallucinations. Catatonic depression. Key feature: catatonic depression is a rare but serious condition characterized by severe disturbances in movement and motor behavior. Key symptoms can include complete immobility, stupor, unusual body postures, mutism, resistance to instructions, repetitive and purposeless movements, mimicking the movements of others, echopraxia, or mimicking the speech of others, echolalia. Depression due to a medical condition. Key feature: in this type, depressive symptoms develop as a consequence of having a chronic or serious medical illness, such as cancer, stroke, Parkinson's disease, heart disease. Key symptoms: low mood, feelings of hopelessness, fatigue, loss of energy, loss of interest in activities, often experienced in the context of the underlying medical condition. Depression in adolescence. Key feature: depression during adolescence can manifest differently than in adults and is often linked to hormonal changes and the physical and psychological developments of this period. Key symptoms: irritability, depressed mood, loss of interest in activities, decline in academic performance, social withdrawal from friends and family, feelings of worthlessness, sleep and appetite problems, and sometimes risky behaviors or self-harm. Depression in the elderly. Key feature: diagnosing depression in older adults can be challenging as its symptoms may be mistaken for those of other physical or cognitive conditions, such as dementia. Key symptoms: lack of motivation, feelings of fatigue, decreased appetite and weight loss, sleep problems, reduced memory and concentration, which may be confused with dementia, social isolation, and vague physical complaints. Masked depression. Key feature: in this type of depression, psychological symptoms are not directly expressed, and the individual primarily suffers from physical complaints. Key symptoms: headaches, chronic bodily pain, gastrointestinal problems, fatigue, and other physical symptoms without a clear medical cause, while the individual may not directly report feelings of sadness or distress. Key point: it is crucial to remember that depression does not always manifest with obvious feelings of sadness and grief. In fact, some individuals with depression may not even experience a feeling of sadness, and instead present with physical symptoms or significant changes in their behavior. This underscores the importance of accurate and professional diagnosis of depression by a psychologist or psychiatrist. Early diagnosis and appropriate intervention can significantly improve the quality of life for individuals living with depression. Join the circle of mindful individuals. If you are also interested in gaining a deeper understanding of topics such as depression, anxiety, the importance of self-awareness, the path of personal growth, and maintaining mental well-being, we sincerely invite you to join the growing community of the Mental Today channel and benefit from our valuable and informative content. By joining us, take a significant step towards enhancing your mental health and that of those around you.